CDC report posits that while vaccine effectiveness against infection may have fallen because of the Delta variant, vaccines are still significantly effective in protecting against severe disease and death from COVID-19. The U.S. Centers for Disease Control and Prevention, CDC, released a report that monitored the incidence of COVID-19 cases, hospitalizations, and deaths by individuals' vaccination status from April 4 to July 17 across 13 jurisdictions. This is the time when COVID-19 cases due to the Delta variant of the virus had started to surge in the country. In the U.S., 3 vaccines are being administered currently, including Pfizer-BioNTech, Moderna and Johnson & Johnson's single-dose vaccine. The report has come just around the time when U.S. President Joe Biden announced new federal coronavirus vaccine requirements as the country is struggling to contain the highly infectious Delta variant of COVID-19. Biden's mandate calls for compulsory vaccinations of employees of federal government and large private sector companies. The mandates are not being welcomed by everyone, especially some members and supporters of the Republican Party, who see them as infringing their freedom. As per latest data from the CDC, 53.6% of people in the U.S. are fully vaccinated and 62.9% have at least one dose of the vaccine. Broadly, the report says that the incidence of SARS-CoV-2 infection, hospitalization, and death is higher in unvaccinated than vaccinated persons. It also says that the incidence rate ratios of the disease are related to vaccine effectiveness. In other words, the report posits that while vaccine effectiveness against infection may have fallen because of the Delta variant, vaccines are still significantly effective in protecting against severe disease and death from COVID-19. In the 13 jurisdictions that were assessed, between April 4 and July 19, over 569,142 COVID-19 cases were reported among the unvaccinated people. These cases were 92% of the total cases detected during the time. Significantly, 34,972 hospitalizations, 92%, and 6,132 COVID-19 associated deaths, 91%, were also reported among the unvaccinated people. In contrast, cases among fully vaccinated people numbered at 46,312 or 8% of the total. 2,976 hospitalizations were reported among them and 616 deaths. Overall, during the period between April 4 and June 19, fully vaccinated persons accounted for 5% of the cases, 7% of hospitalizations and 8% of deaths. At this time, the vaccination coverage was 37% in the areas surveyed. The report notes that assuming vaccine effectiveness of 90%, vaccinated people should have contributed 6% of the total cases.
Thanks for watching this video. Please do subscribe All Media New York.